The World Health Organization defines meningitis as inflammation of the membranes that cover the brain and the spinal cord. The most common causes of meningitis are viral and bacterial infections. Globally, the disease affects more than 4 million people, most of whom are in 26 African countries. In the West African sub-region, about 900,000 cases were reported in the last 15 years. Of these cases, 10% resulted in deaths, with another 10 to 20% developing neurological problems. In Ghana, the disease is mostly recorded in the northern part of the country during dry periods with relatively low humidity and abundance of dust. More than 3,000 meningitis cases and 400 deaths were recorded in the last 5 years. In spite of measures put in place to control meningitis in the country, the Upper West region continues to suffer a series of cases. In the last 13 weeks, the area recorded 247 cases with 37 deaths. The Nadowli Kaleo district is the hardest hit, with 74 cases and 12 deaths within the period. I have come to the Zambaro community in the Nadowli Kaleo district to meet 48-year-old Amadou Osman, who lost his 13-year-old daughter to meningitis last week. He tells me he is yet to overcome the agony of losing his beloved daughter, who was referred from a CHIPS compound in a nearby community to the Nadowli government hospital.
Mbieni nema hada kwemang awo obalo non tabbe abira yinipu nchale ofa ale ongone tuware nema hada kwemang ka in yuware turi binseng ko mbatia hale ndabatia hele mbayan kare na kunyan chanu sala le ofa wienle awo obalo no kunne ada venyan ka enchuare ka ngbangotre yansan cheto no salba kayalma pare taman kuri kanyiri bantur kuruma kanyiri ntia kanyiri pu mamento nambe awoto jinen atore.
The Upper West Regional Director of Health Services, Dr. Osei Kuffuor Affreh, blames the rising incidence of meningitis and its related deaths to stigma and the refusal by residents to report early for treatment at the various health facilities.
2 organisms are causing the deaths of meningitis. That is strep pneumo, giving us pneumococcal meningitis, and also Neisseria meningitidis also playing along. So about 50% of our cases are being caused by strep pneumo, and then 50% of the cases are also being caused by Neisseria meningitidis. But contributory factors to this increasing number of cases has been people are still not reporting early to our health facilities. And that is a big challenge for us as a health institution or health service. Because when they come in and they come so late, then it becomes very, very difficult to manage them. So we are still intensifying our health education just to make sure that even though the COVID fever is all over the place and people know basic things about COVID, they will not forget about meningitis, and they will be able to fight meningitis as well.
Some residents in the Upper West region, however, want stringent government intervention to nip the rising number of meningitis-related deaths in the bud.
Every year, we have cases of CSM, especially in the Upper West region. And unfortunately, we have not been able to, it has not gained that publicity as compared to the COVID-19. And so I will plead that government and other stakeholders, NGOs, they will also turn their eyes towards how to prevent and curb, CSM. As of now, we have about 37 cases in the region, which is very, very alarming. 37 deaths, which is very, very alarming.
When I hear of the figure, initially you would wonder. It takes me back to a story when we were in primary school, where usually they will gather you at the school and inject you. One question keep bothering me: what has happened? Why can't the regional health directorate take up that exercise that used to happen, and you never even hear of a single death? How come? Has it been forgotten?
From Zambaro, here in the Nadowli Kaleo district of the Upper West region, my name is Latif Mahama, City News.